Hello, ATG. This is Dr. Esther. I'm one of the admins at AsktheGynaecologist, and today I'll be talking about folic acid, the importance of folic acid before and in pregnancy. So, as usual, I'm going to be waiting for people to join in, and I want you to please tell me if you can see me, if you can hear me, if there's anything that I need to do right. So I'll be talking briefly about the importance of folic acid. Why do we advise it at a particular time? What are the importance? What are the complications or the likely things that can occur when you don't take folic acid? So join me. I've heard a lot of things, people saying it affects their ovulation and all of that. So I'll be attending the questions too after the presentation. Marufat Rashid is here. Thanks for joining me. Say hi, ma. Okay, Zoba says yes, I can see and hear you. Thank you so much. Thank you so much. I needed to know that. So I just be waiting for a few more people to join in, and then we're going to be starting about the importance. Great, I have the numbers that is needed. I don't want to spend so much time or wasting time still going around. So I'll be talking about folic acid. What is the importance of folic acid? Why do we say every woman, if you're planning to get pregnant, take folic acid? People will ask, is it fertility drug? Some they have erroneously thought when we say that it means that it is a drug that is going to get you pregnant or so. Nobody is claiming that. Nobody is saying that. But what is the importance? Why do you need folic acid? So I have many people saying hi. Love is here. She's saying hi. Okay, Beauty. So he's saying hello, doc. Hello. Thank you all for joining me. Adepedu says we are ready, ma. I'm ready too. So thank you, everybody, for joining in. So why is folic acid? Why is it important? And why do we say you have to take it like at least 3 months before you start, before you get pregnant? Every woman, if you're fertile, and you intend to get pregnant, or you're not intending to get pregnant, but if you're sexually active. So I'm going to put that caveat, because a lot of people get pregnant. They didn't plan it. They were not looking for pregnancy. It was just supposed to be for fun, and then they got pregnant. So whichever way, whether it was something you planned or something you did not plan, no baby needs to come into this world to suffer for some of or whatever is our decisions. So if you're fertile, you're a lady, you're a woman, that you're fertile and you're sexually active. You're sexually active, and especially if you're not on contraceptive. But even with contraceptives, mistakes occur. Babies, they decide to show up when they want to. So every fertile woman, if you're fertile, you're ovulating, you're menstruating, or any of this, you need to be on folic acid. And especially for those that are now planning to get pregnant, or you have a child, you're married, you've had your child now, and then the child is about 1.5 years or something, you're beginning to plan, you and a guy are beginning to think, I think we should have another baby or so. From the moment you begin to think, I think I may need another baby, start taking folic acid. You need a folic acid, at least 400 micrograms daily. You need it. For a non-pregnant woman, you need that. In pregnancy, and especially in early pregnancy, the need increases to almost ×2 of that. But there's a popular one that is so cheap, is available. You can get that readily in Nigeria or anywhere in Africa. It comes as the one they call counting. Very cheap, very cheap. You can get 15 naira folic acid that will last you for more than a month. That's the counting type. They usually come as folic acid 5 milligrams. That one is also fine. At least 3 months to pregnancy, take it. And why? Why are we particular about that? Why are we giving a time frame? Because folic acid is not stored for so long in your body, so you can easily deplete your store. Your body does not. So someone is already asking, please hold on with the question to the end of the presentation. Does it help one get pregnant? No. Folic acid does not help you get pregnant. It is not a fertility drug. But that is the reason why that's why I want to explain now. Folic acid is very important in the development of your baby. It is important even in adults and in children, but for babies, for tiny little babies that are being formed at that stage, they are there's something we call rapidly dividing. They are rapidly developing. Organs are being formed. The neural tube is being formed. Their brain is beginning to form. And all of these things, they require folic acid. It's an essential process. There are so many medical jargons that I won't have to go into. Forming your DNA of your baby, forming all of these things, folic acid is needed. It is the active form it converts to in your body is called folate. It is necessary. And if you're deficient in it, your baby may not develop well. Your baby may develop issues. And a lot of us, we think we are just fine now. Right now, we are just fine. We are doing well. We could have been better if our mother knew. Some people will say, but our parents did not do it, and here we are. I used to tell some people sometimes when I want to joke too, I said, and here we are. You can see we are not inventing anything. Maybe if we had been adequately breastfed, or maybe if they had done some of these things, maybe we would have also been creating some things. That's just on a lighter note. But it can be true. Because the truth is, the fact that it's not just enough that our baby live and they just, they are just fine and they are not dead. It's enough. What matters is we need to give quality of life. Our kids has to be the best. Invest in them. So the way you can start, one of the ways you start investing and preparing for your child, if you plan to have one, take folic acid. From the moment you think, I want to get pregnant, or start taking folic acid, go to your pharmacy. It's not expensive. You don't have to go and buy expensive brands or any of them. What is needed daily? Folate that is needed in the body, you need 400 microgram daily. But the popular one that is common, the counting type, it is cheap, comes in 5 milligram. If you want to convert that to microgram, that will be about 5,000 microgram. But you know what? It doesn't matter. Your body is going to store it up, and the excess is going to be excreted. So it's not enough. Now, Dr. Esther said we can take it. If you take so much for a day, your body will only take what it needs. It flushes out the rest, and it stores some. And the pool that you have, your folate pool you have in your body, can only last you if you stop every source of folic acid today. If you stop every source, maybe you're not taking vegetables, leafy vegetables, and all of that. If you stop taking every good source of folate today, in 4 months, 3-4 months, you may have depleted your store. The folic acid, the folate that is stored in your liver would have been, you can actually be deficient, would have been gone. So that's why we encourage women at least 3 months to when you begin to think you want to get pregnant. If you look like, okay, I'm going to start trying to get pregnant when my baby is 15 months and your baby is 12 months now, your baby is 1 year old, start taking it now. Start taking it. Your body is going to store what it needs. The excess is going to be going out. They are water-soluble vitamins. So your body will excrete it. It takes you overdosing a lot of it for you to harm you. So just take the one you need daily. If you have some of the ones that have been tailor-made, some will just be exactly 400 microgram, some will be exactly 800 microgram, or some, the counting type will be 5 milligram folate. That's okay. Start taking 3 months before pregnancy and 3 months into pregnancy. The first 3 months is very, very important. And the reason why we're saying it is those first 3 months, a lot of women they're not aware they are pregnant. A lot of women are still doing stuff all around. They are still eating junks. It's that they just wonder like, wow, I didn't see my period last month, 2 months ago. Wow, am I pregnant? So that is why you need to be taking folate, because you may not be aware. And another reason why you need to be taking it before you get pregnant is because first trimester may not be funny for some women. Personally, I'm someone like that. Pregnancy starts dealing with me as early as 5 weeks, like just 1 month. I'm supposed to see my period just like last week. From this week, I'm start feeling pregnancy starts dealing every blow, like nothing stays down. I'm able to keep anything down. You're vomiting, you're being admitted, you're doing that. Imagine you've not been taking folic acid. Nothing stays down. You can't keep anything down. Now, if you don't have enough pool, if there is not enough in your bank, it's just like when COVID-19 is eating everyone in the world now. How do you survive? Everyone now has to survive on whatever they have in their savings. If you don't have savings at this time, it is so difficult. Life is so difficult. That's what happens to the body. If you don't have the pool, your body is going to bank on for some time, because you're not going to be able to tell. Some people say, I don't used to have morning sickness. Don't worry. Well, I'll just be taking folate when I discover. No two pregnancies are the same. The fact that you've had 2 kids and first trimester was just an easy breeze. This next one may come to you like bazooka. Pam, and you're down. You're not able to eat. You're not able to put anything down. Your pool, what you have in your reserve, is going to be what is going to save you. For those that are asking questions, I'll not be able to answer your question, and I'm going to likely miss it. So hold on with the question. So this is why it is important for you to take folic acid. You say, can an unmarried lady take folic acid? Is related to what I'm talking about. So I'm going to answer yes. As long as you're sexually active, that's what I said. If you're sexually active, you are not using contraceptive, because you can actually fall pregnant anytime. You can get pregnant anytime. So take folic acid. Don't let your decisions, if you're having fun, you believe it's just supposed to be for fun, you may get pregnant. Even some with contraceptives, sometimes it fails. So it's not 100% if it occurs. So take folic acid. Your body is going to store what it needs, like 3 to 4 months supply with your good liver. It's going to store it up. And then after, the excess is going to be excreted, as long as you're not overdosing, because when you overdose on anything in life, it's too much. Just one tablet, 5 milligrams of folic acid every day, just take it, and you're good. And as long as you're also eating, some people say, I can't take folic acid, I can't. Then begin eat. Be very sure you're someone that you're eating vegetables. The way we cook our vegetable back at home, we actually lose a lot of the nutrients. We overcook, we overboil our vegetables. So you may not actually be getting so much from these things. They may help, they have their other benefits, they help with the constipation, the iron. But the way we really cook, sometimes we damage some of our vitamins. So that is why we encourage this supplementation, folate supplementation. So it's as long as you're sexually active, take folic acid. Take folic acid. You need it. You don't want your baby paying for it. Is using omega-3 with folic acid, is it enough? I am not talking about omega-3. Nobody is talking about your omega-3 here. Omega-3 does not even rank in the priority of things. If you're eating fish, you can get omega-3 from it. Don't let anybody just keep siphoning money away from you. But the very important, the basic thing you need, folate. It is very, very important. Your body can only store for as much as 3 to 4 months, and then that goes away. If you don't come down with hyperemesis, the kind of people that they vomit and vomit and vomit, and I know what it means. I know how it feels like when people begin to say, I feel it. For every of my pregnancy, I was literally in hospital. I was always in the hospital. You vomit until I start, sometimes vomit, and when I start feeling blood, I start vomiting blood, you go to the ER again. I go to the emergency, they transfuse, they give you water, hydrate, give me some drugs, I get better for a week or two, and then the vomiting cannot be controlled again. You go back again, and so I understand. It is your pool, it is what you have in your reserve. Your body is going to need to save your baby. Otherwise, the baby can develop some defects. Those are the times when your baby needs it. The baby is rapidly developing every organ. By 3 months, every organ in your baby's body would have formed. By 3 months, the rest now requires just process we call mitosis. They will just be getting bigger, getting more functional scale. But by 3 months, your baby has almost formed every organ it needs in the body. So at that moment, with the things you do in the first 3 months of pregnancy, they can change the course of your pregnancy or your baby forever. So people don't understand they're pregnant the first 3 months, so they may do some dangerous things. They're still taking alcohol. They are still taking paraga, some herbs that are made with alcohol. You'll be taking alcohol, you'll be doing this, when you take alcohol, you settle down, not knowing they're already pregnant, doing damages to the baby. So sometimes a lot of people, they may lose the pregnancy, and all of that. The things that happen in the first 3 months of pregnancy, they can change the course. Some people, it changed the course of a child forever. The way the brain is developing. So that's why you must actually think. Don't just think because our parent did it. They did it, and we are here today. It's not just enough for your baby to be here today. Are they in their best? Are they their best? That is what you have to consider. You have to do your best to be sure that you do the best for the sake of your babies. So folic acid is very important. 3 months from the moment you begin to think, I think I want to get pregnant, go get folic acid and start using, because there's mirror tube defect. You can have babies that are going to be born. The babies can be born without, at the back when they are born, at the back you find the spinal cord, there's a fusion, there's a lack of fusion. So sometimes you find their spinal cord outside. Some, there are different degrees. Some can be spina bifida or occulta. Some can be, it may not even be, it may not know that is, the child may not know. Sometimes you don't discover that the baby is having difficulty, walking early. The doctor may now notice there's some mark on the back of the baby. It may be some degree of spina bifida. Some can be so devastating, some can be severe. The baby's brain was not properly formed and can cause a case called anencephaly. The baby's brain, as in like baby that does not have brain, really. Sometimes some baby may survive it, some baby survive, they are not really smart, they are not really sharp, and stuff like that. Before you know, and in Africa, what do we try to say? We're going to say it is the mother walked in the afternoon. Then the mother, when she was walking in the afternoon, she gave birth to a ghost. You wouldn't know it was because she was drinking paraga, she was drinking all sorts of herbal mixture, she was drinking she was not taking, what is it called? She was not taking any stuff that is healthy for her and all of that. And that is what is causing why she's beginning to have, what she's having. So it is not enough for you to just have a child. It is okay for you to have an healthy child. That is what the goal should be. Someone say, Doc, can you continue taking folic acid when pregnant? Yes. So that is the part. You need to take folic acid at least 3 months before you get pregnant and at least 3 months into pregnancy. At least, I said it, that first 3 months, they are the most important times for folic acid. But we advise you take folic acid throughout pregnancy. But if you can't take it throughout pregnancy, maybe you don't even just tolerate it, you really don't like it. Some people just say, I don't like it, I don't like it. I know you don't like it. Nobody likes to take drugs. But for the sake of your baby, that first 3 months, it is very, very important. Take it. Can men use folic acid too? It's okay, men can use it, but you know, you're not the one really carrying babies, so it may not be as important as female. The woman is going to be the one to carry the baby. The body is going to be making demand on a pull, so that is what is important. So I'll be taking questions because that's what I want to talk about on folic acid. The body develops the first 3 months, the baby is developing, and it needs all sorts of, it develops, organs are being formed, so the baby needs all the nutrient from you, the mom. Someone say, please, what of pregnant care? Pregnant care is okay, but for someone, pregnant care is expensive. If you're not pregnant, pregnant care is something that is expensive. Just take folic acid and you're eating healthy, much more than taking folic acid. If you're planning to get pregnant, if you're someone that you're planning to pregnant, there are some of the things. Someone says, what of someone who has had an encephaly child before? Thank you for raising this question, Becky. If you have a child that has had an encephaly before, or you've had a child that has spina bifida before, you are in fact, as a matter of fact, you're going to be placed on a higher dose because you are at increased risk of having another child with such defect. So you must, as a matter of fact, it becomes so compulsory. It becomes like it must be a routine, it must be a religious thing. You must make sure you're on high folate dose you're going to be given. And in such women, you want to be sure, what are the drugs? Are they taking drugs that may actually be blocking folate from working in their body? So you want to be sure in that. So folate is very important. Otherwise, the brain is not fully formed, the spinal cord may be affected, organs that are being formed, the body needs DNA, to make DNA to keep the baby dividing. It can be affected. Can folic acid prevent miscarriage? In a way, yes and no. This is it. Most miscarriages, they may be due to abnormalities in the baby. Most are due to chromosomal abnormalities. You couldn't have helped that. Maybe something is wrong in the chromosome and all of that. The body decides to stop supporting that pregnancy and throws it out. Or there is a severe, like babies that are, like I just mentioned, some babies with anencephaly, their brain did not develop. Usually, some of these babies, if they are born, there's a particular facie, the way they look. They look, it's not a funny look. When the body discovers this, those kind of babies, they're not able to produce, they're not able to swallow, the amniotic fluid and everything. The mother can come up with polyhydramnios, a lot of things happening. The body can sense that this baby is not right. So along the line, the body may decide to contract and expel this baby. So it's a form of miscarriage. So folate may have prevented anencephaly. So folate may have prevented miscarriage in that sense, but most miscarriages are due to chromosome issues that is not folic acid related. So in those kind of cases, folate actually can work. It's not what is needed. Hi doctor, I gave birth last year, a period through CS, but lost the baby. Been trying to take in again, but it's not coming. Should I be worried? No. You just had last year April. It takes some time before your body gets to regulate itself. You just had a major obstetric event. It requires the body regulating itself. From the time your body regulates itself up to now, it may not be up to a year. But if you think there are issues, you need to see a gynecologist just to be sure your hormones are right. What is the advice to couples who have married for 5 years without pregnancy? They need to see a fertility specialist. I may be referring, they maybe actually ask them to go to a gynecologist or a fertility specialist, depending on their age. If they are up to anything above, if you're 35 years, and above, please don't even wait with a gynecologist. Head straight to a fertility specialist. They will want to quickly do interventions may be needed early enough to help, boost your chances, because time is of essence. If you're trying to get pregnant, you've been trying pregnancy for 5 years, that calls for you to see a specialist. You need to help. Which food sources is rich in folate? Green vegetables, green leafy vegetables. So you're talking about our efotete, or the dikaikong, green leafy vegetables, and that's what kind of vegetables we have. They are very good sources of folate. They are very good. You eat them, you can get your folate. Some food are also supplemented with it, like some cornflakes, some of this cereal, even some of the semo. Some of them you can check on them. They may be supplemented. They are very good. So someone says, what can I do aside from taking folic acid to prevent such again? You want to be aware. You want to live a healthy life. You want to be aware of things that you take in. You don't want to be around someone that is smoking. You don't want to be a smoker yourself. You don't want to take alcohol. And just eat healthy. Folic acid on high dose. Those are some of the things that you can take. Does folic acid make fibroid grow? No. That's one of the erroneous things that is being peddled around. No. A fibroid grows on estrogen. fibroid, wherever there is fibroid is something that loves fertile women because you have estrogen. You have it. That's what fibroid loves. And it is not folic. Folic acid is not what supplies your estrogen or so. So it is not what causes the growth. Definitely, I think the way some people that are propounding it, because they will say, because fibroid is growing, it's going to need folate also and all of that. Fibroid is going to take from your pool, whether you're taking folic supplement or not. It thrives on hormones, not on the folate. What can someone do to set a womb that fall? I don't know what you mean by your womb that fall. If you have a womb prolapse, the person that is meant to help fix womb prolapse is a gynecologist, and it's going to require some surgery. There's all this womb setting. Don't let anybody who sets any womb that is not out of place. Don't go looking for what is not lost. Womb setting, I usually know when people talk about womb setting, they want to go and meet some old women somewhere that will be turning and shaking your tummy and all of that. Those things don't work. You're just inflicting yourself with wounds. Someone said, Dr. Esther, please check your DM. We don't respond to messages in our inbox. If you want to reach ATG doctors, please subscribe to our premium service. That is how we roll. We want you to subscribe to premium service. We can't attend to everybody. Intermittently, I have to respond to questions. But if members get to have a glimpse into what my inbox looks like, I miss both messages from family members and everything. Messages are full. Some are coming in. Some are in message requests. And some Facebook will not even show me at all. It will be in the spam folder. Somewhere. So I can't be able to attend to every of this question. But the obligation, those that are registered on ATG Premium, it is an obligation for that we answer you. You must get a response from us. You've been sending messages. You're not getting response from ATG doctor. It just means you're not doing it the right way. Subscribe to, if you want one-on-one conversation with us, consultation, subscribe to ATG Premium service. Okay. Okay, so Dev Eruku Steph, you're out of line. You're saying what is not. You stop giving our message. Stop telling our members things that are not science based. You're telling how you meet those women that do massage women body. They will set it for you. You are wrong. You don't say those kind of things in ATG. Normally, if I wasn't having my live, I'm going to delete your comment and I'm going to block you out of the group. It is wrong. Don't give you don't direct our members to those things. We guide ATG jealously because we are careful of the information being passed to members. When we refer you to gynecologists, we just want you to know better, not because we are gaining from it, but for you to refer someone to a place that can actually affect them, that can damage them. We guide what is being told to our members. Stop it. Eruvu, Steph, you're saying the wrong thing. Stop it. You don't advise our members. You don't tell them to do those kind of things. We are not local women here. Please. How would you know that subchorionic bleeding is resolving? There's no way for you to know. It just resolve. It can resolve on its own. That's bleeding behind the placenta. This usually occurs early in pregnancy. It's common in some women. It gets resolved sometimes, but it needs to be monitored. You may be asked to have some more frequent ultrasound to check. Is it progressing or is it resolving? But you yourself, how do you get to know? Not really. There's no way you can really know. Someone say, I always have slight headache when I'm taking folic acid. What's the curse, doc? I sincerely don't know why. Because folic acid should not cause you headache. But if you're not able to tolerate it for any reason, maybe because the truth is drugs, our bodies just react strange. Some people, your body may react strangely even to the least and most harmless thing in the world. So if that is the case with you, you just want to make sure that you are taking enough vegetables, green leafy vegetables. Be very sure you're not overeating your vegetables. You are not cooking until tender. Some people will say cook until tender. In fact, if you're able to wash your vegetables correctly, you're able to wash them off. Be sure that you're washing away germs. The more raw your vegetable is, the better, because you get all the nutrients in it. Doctor, please, can a pregnant woman take folic acid, vitamin B6, and vitamin E? I don't know why she's having vitamin E to it. Vitamins, there are some vitamins we call fat soluble. You don't want to take them indiscriminately, because your body gets to store them. They are fat soluble. They will go and store up. Your body stores them up in your fat, so they don't get excreted. So you can get intoxicated with them. As you're feeding your body, the body is loading it up. Those are vitamin A, and vitamin A in first trimester a lot. We even don't want women getting it in first trimester, because it can actually may be toxic, may be teratogenic if you have it in high doses. Vitamin A, vitamin D, vitamin E, vitamin K, you don't just want to take it anyhow, except your doctor recommends it. In a pregnant woman, you need folate, you need iron, vitamin E. Yeah, there's some degree. Everybody needs vitamin E to some degree, but not like you going out specially out of your way to supplement it, except you are particularly deficient in it. Please, doc, ovulation test that 95.43. What does that mean? I don't know what this means. I don't even know what test you're talking about. I don't know what test this is. That is ovulation that is giving 9 points. So I don't know what this value is. Can I take pregnant care in place of it? Yes, you can take pregnant care. Pregnant care is supposed to contain, that pregnant care, I believe, is supposed to contain folic acid. Folic acid, 5 milligram or 400 gram, which is the best to take during pregnancy. Any of them will fly. Any of them, as long as you're taking each own. The truth is, the 5 milligram is not totally like 5. Everything is 5. When it's broken down, the elemental part of it will not be up to 5 milligram. So with 400 gram, you're talking about is 400 microgram. I know it's just a mistake. 400 microgram. That is what your body needs, and it's going to get, when it gets enough of that, when it gets elemental with your food and everything, you get enough that you need. So whether it's 5 milligram, the 5 milligram type is usually cheaper, and if you're able to, it's more affordable. Times are hard. I tell our women in ATG and C, if you think pregnant care is expensive for you, some will say their pregnant care for 1 month is like 10,000 naira. Wow, that's much. Do counting type. Count. Folic acid count. The counting, the B complex that is the counting type. They all do the same job. They will all do the same work. Someone say, how long can one take folic acid before pregnancy? Every day for 3 months or less. If you started this presentation with me, I said whenever you comes to your mind that you want to try getting pregnant, or you're having sex, you're a woman that you're fertile, you're having sex, take folic acid. That's at least 3 months before getting pregnant, and at least 3 months into pregnancy, because the first 3 months of pregnancy, they are the most crucial, they are the most important, where your body really needs folic acid. Someone say, how do I subscribe to H2 Premium Services? The very first post in this group, if you come into this group, the very first post in this group that is in the announcement section, we actually contain our services run. You can check on that post, or you can just type in premium service in the search bar. You can get so much information on that. Can someone who is looking for fruit of the womb can use a drug called Every Woman? I don't know what you mean, but if Every Woman means a prenatal vitamin, I'm going to assume, I'm assuming it's a prenatal vitamin. It's a vitamin for the woman trying to conceive. That's okay. But I don't know what is in Every Woman, so I do not endorse it. I do not know what it is, so I'm not able to answer that question. Doctor, please, how long can I wait to get pregnant after a CS? For cesarean section, at least wait. The truth is, whether you had a child, through CS, the baby died, or you had a child and then the baby is alive, it still does not change the fact that you had cesarean section. And you need the wound, you need that scar, you need the womb to heal. No less than 1 year. Some will tell you their doctor said 6 months. That's fine. But the truth is, in between, the shorter the time from your last surgery, your CS, to the next one, that increases your chance of your womb rupturing, both in pregnancy or in the next delivery. So allow the time to heal. Not less than a year. No less than a year after CS. No less. Can be more, but not less. Someone says, please doc, can excess consumption of pepper cause a miscarriage, especially in the first month? No. You eat pepper, it goes into your stomach. It goes there. From there, it goes to your duodenum, to your ileum, and to your jejunum, to your ileum, and then it goes into your colon and all of that, and then you pull it out. It does not touch your womb. There are two different ways. There are two different compartments. No, pepper does not cause miscarriage. If you're allergic to pepper, that's maybe something else. There's some people, maybe if you take a particular species of pepper, they can start freaking out. Maybe you can start having allergic reactions. That's different. Maybe due to the allergy, your body mobilized so much, inflammatory response. Maybe that caused it. But that you ate pepper and it was because it was so hot, and then no, that does not fly. What could be a cause of waist pain for 2 months pregnant women? There are so many discomforts. It's very common in pregnancy. So those are part of the things pregnant women may have to go through. But there are some that may be due to, round ligament pain. Some can be due to, symphysis pubis dysfunction. Depends on what type. I'm going to encourage you to join our ATG antenatal platform on Telegram. We discuss this. You're able to ask a question. You're going to be able to get articles. The articles in this group also, and also in our ATGNC. We're able to tell you, other pregnant women will be able to tell you things that they did that also helped them, that is approved by us. Some will tell you, I did this. Maybe I did this and all of that. I may come online like, hello, that is not right. So you're able to get correction. No. This woman said this, but you don't do it. What she did was wrong. And then she will also know, I didn't know. I learned that, I just learned that, and all of so this is what our ATG antenatal platform is for. You can get access to us easily. You can ask your questions, the funny pregnancy questions, any type at all. We are there to answer your questions. So if you're pregnant, consider subscribing to ATG Antenatal. Throughout your 9 months, we can work with you. Please, doctor, can folic acid boost fertility? No, folic acid is not a fertility drug. But if you have a folate deficiency, for you to be folic acid deficient, there's likelihood you're also lacking some other vitamins. So meaning you're not eating healthy. So your fertility may be suboptimal. You may have subfertility. So that may account for it. But like folic acid itself, increasing your fertility, making you pregnant, no. But for someone that is folate deficiency, you are deficient in some other vitamins too. And I'll be looking out for that. So no folic acid as a fertility drug. So someone says, Doctor, please, I want to subscribe. Please check. You can check our platform. We have details on how you can subscribe. Just type in premium service. You'll see the details. If you're pregnant, just type in antenatal. You're going to see all those are just keywords. They're going to jump at you. If you're trying to conceive, you're one of those we call going to conceive, GTC. We have a GTC platform, Telegram platform, where women that are also going to conceive, you can ask your questions. ATG doctors get to answer you. You can also subscribe. It's a 1-year access. You can be on that platform, you ask your questions with other women, and then you get to connect with each other too. So you can just type in GTC. You're going to see all this information. They are just keywords. Type in antenatal, type in premium. You're going to see this. They're going to come at you. The words, the information you need to come. Can someone with one fallopian tube get pregnant? What are the chances? Yes. With one fallopian tube that is open, that's the word. If maybe there's an ectopic pregnancy, one tube was removed, the other tube, if open, I have to emphasize that it has to be patent that the fallopian tube is open. Yes, you can get pregnant with that. Pregnancy is very possible. Many children can still be birthed with one tube, so it's possible, and the chances, very good chances. Is a particular kind of folic acid to use? And it's the same with the one used during pregnancy? It's the same. They are no different. Can you get pregnant with a regular period that still falls within the normal cycle of 28 to 35 days? Yes. But I have to be sure the fact that your cycle you still have a normal cycle, and if you've been trying to get pregnant and you've been having adequate sexual exposure, you have to be sure that you're actually ovulating. So you may still need some tests. If you've been doing all of that and for a year you have not gotten pregnant, you want to check if truly you're ovulating. You want to check the sperm if it is adequate. You want to check if your tubes are open. So there are so many things you need to. Can fibroid lead to premature rupture of membrane? Well, unlikely, but yes, it may be. Maybe it's located in a very funny position but a lot of things are going to need to precipitate that for a fibroid to cause that, but no. But a lot of us, just, because fibroid is so common, and sometimes when women have prom, when it occurs, everybody, it's just normal, human nature. When things happen, you just want to know why. You want to find someone to blame, and sometimes fibroid is the guy or the lady that takes the blame. So fibroid causing prom, it's very unlikely. Please, I lost my baby last year through CS due to wall defect she had, and I was placed on 800 microgram of folic acid, trying for another baby, praying it went well. It's going to go well. Your baby had if it's an abdominal wall defect, I don't know the defect you meant, but for your doctor to have placed you on a higher dose, I'm thinking at the back, that may be at the back, maybe spinal bifida. So you're already on it, you're in high dose, 800, yes, and that's what you should be on. Take it religiously, have adequate exposure, and yes, you're going to get pregnant again. Whoa. Please, can folic acid improve fertility? No, it is not a fertility drug. What's the work of Clomid? Clomid is an ovulation-inducing agent. It is being prescribed by a doctor and needs to be monitored. It's used to help women that are not ovulating. It's like a form of way you want to whip the ovary. Maybe this ovary is not releasing egg. You want to tell her, madam ovary, wake up, release. You have to do your job. That is what Clomid is actually meant to do. And the pathway with which you do that, I don't want to bore you with all of those. But the major work it's going to do on your ovary is to stimulate madam to release egg. Do your job. If you're taking foods rich in folate, do you still need to be taking folic acid while pregnant? You may be getting enough, like I said. You may be getting, if you're eating healthy, you're eating well, you may be getting enough folate that you may not need supplementation. But are you sure the food are actually rich in it? Are you sure you did not overcook your vegetables? Are you sure that your food is supplying everything you need? You just don't want to take chances. Why not take folic acid? I mean, just that's it. The truth is, if you're eating healthy, maybe you're eating, especially if you're someone that you eat a lot of veggies, vegetables that are not overcooked or that are not being warmed for 3 days ago. You warm them and you're almost losing every vitamins in it. You may be getting enough and you may not need supplements, but I'll rather err on the side of caution and take it. Doc, please, one with hormone imbalance, get pregnant while using folic acid. Folic acid, like I said, I've been repeating it over and over. It is not a fertility drug. So if you have hormone imbalance, you have to go, your gynecologists are going to give you drugs that are going to help balance the hormones, help correct the imbalances. Not folic acid correcting hormone imbalance. No, they are two different things. Folic acid 5 milligram or 400, that's microgram, which is best to take during pregnancy. Either of the two is okay. There's no best. As long as you're taking it, you're eating your food. Those work. Okay, so my doc, please, what is the cause of missed abortion or miscarriage without bleeding? Missed abortion, like I said to one of the questions earlier, the commonest cause of miscarriages, early pregnancy losses. They are due to chromosomal imbalance. In a woman, for a woman, if you're 30 years old, your egg is 30 years plus. Really, like 30 years, and then because before you were born, your egg has also been in you, so as well as old as you are. So in the process, we've been in the sun, you have had some stress, we've eaten some food that have toxins, a lot of some things. They could have done some damages here and there in our body, in the egg, due to some errors, some mutations, some stuffs can go wrong. There may have been some mutations, there can be some errors in some of this egg. If it gets fertilized, these eggs, they may have issues. Those are chromosomal issues. When your body notices stuff like that, it's going to feel like, wow, what is wrong with this? What kind of baby is this? Or what kind of baby is going to be formed? It stops supporting it, and then you kind of lose that kind of pregnancy. So most of them are due to factors that you can help, chromosomal issues. That is why some defects or miscarriages can be commoner in women that are older. The older a woman is and we call advanced maternal age, we call it from 35 years and above. But especially with 40, they may have recurring miscarriage because some of the eggs, they are so old. A lot of stuff may have happened. A lot of mistakes, a lot of errors would have occurred in the egg. So those kind of pregnancy may go on to may end up in miscarriage. The body stops supporting it. Some will bleed out, some will not. Will just be there. And those are the ones we call missed. So your body is just a form of your body stops supporting your pregnancy. Most you can't help it. Some maybe due to you're not aware you're pregnant, or the early part of your pregnancy you're not aware you did some things that were dangerous, and you enjoyed the baby. The baby was no longer compatible with life. The body decides to stop supporting the baby, and the baby is not there. So you can either go into miscarriage or that. But most miscarriages, really, you may not be able to help it. Some may be due to they've had some that occur maybe in their mid trimester. We call it like second trimester, early second trimester or so. Some can have cervical incompetence. Those ones you can salvage. Sacklage will be in place to help prevent that. While there are some that may occur, they start losing baby more and more. Maybe those that have been we call resource isoimmunization. They have been sensitized. Those women who are resource negative, maybe she has had abortion before, or she lost a child before, or she had a baby before and she didn't get ROGAM, and the husband is resource positive and she has been isoimmunized. So she discovered that after the first child that she had, getting pregnant again, she's just been having miscarriages, and the more pregnancy she has, the earlier she starts getting miscarriages. It's possible. So there are some you can modify, there are some you can modify. I just mentioned some. Please, doc, what if vegetable is making someone purge during pregnancy? Vegetables are good, but pregnancy presents in funny ways. Some women, they will present with constipation. Their issue is just constipation in pregnancy. While some, they'll just be having diarrhea. So if you're someone that you're having that kind of thing, vegetable makes you purge in pregnancy. Are you, first thing I'm going to want to watch, are you sure there's good hygiene and sanitation with it? Because vegetables, they are very good. They can easily they can actually transmit. That's why I said washing very well. You have to be sure you're washing and then you cook. Are you sure that it's not due to, contamination? If that is out of place, that is why it will be very important for you to take your prenatal vitamins, so that what you're not able to get through vegetables or through fruits and all of that, you'll be able to compensate. Your prenatal vitamin will provide those for you. Okay, so someone says, I always have slight headache when I'm taking folic acid. What's the curse? I don't know the curse. Like I said, your body may react to it funnily. I don't know if this is a repeat question or someone else asked it. Your body may not tolerate it. So be very sure you're taking your good on vegetables, you're taking that, and you're aware. You want to watch what you do, whether you're planning to get pregnant, so you don't do things that are going to be dangerous for your baby. If you're taking, thank you very much for the detailed answer. Okay, you're welcome. Can calcified fibroid or 5 cm shrink on its own? Fibroid don't shrink like that, except you go into menopause. When you hear people tell you that, sometimes when people share testimony as the doctors are the evil, they say, oh, doctors told me I'm going to have operation, but now I no longer need operation. When they learn later check, they discover that the fibroid are shrink and everything that way. We are happy for you. The truth is, not like we just want to. The less people get sick, the easier it is on doctors too. So not like anybody's happy in that sense that you need surgery. But the truth is, if you're no longer fertile, for women, if you're someone that they discovered your fibroid while you were 40-something or you are 50-something, the likelihood you're going to go into menopause soon. And with menopause, your estrogen, your progesterone, they all crash. And fibroid no longer gets to be fed. Fibroid is now beginning to be starved. So the lady is going to shrink. So that's the normal thing. But if you're still fertile and you're still having your estrogen, you're feeding, you're still eating. A lot of people eat red meat. A lot of people take so much junks and everything. Your fibroid can flourish. So it's not like it's going to shrink. The fact that it's calcified does not mean it's shrinking. So you just want to look. But if you're trying to get pregnant or so, 5 cm, the doctor may tell you, depending on the location, you may not need surgery. If it is not symptomatic, let it be. But if it's symptomatic, it's causing you pain, then you need it operated. Okay, someone says, doctor, is it possible for a woman that tested positive in ovulation not to get pregnant after having sex on her ovulation day? It's very possible. That's why we say don't wait for ovulation. Just have sex. And the fact that you are very sure, in fact, even if you are able to open your eyes, you saw your egg, the way it was being released like this, of which you can't see. But let me just even say it. The fact that ovulation occurred and then you had sex does not mean this particular month you must get pregnant. That's why we don't define infertility as just inability to get pregnant. You must have been doing it like that. You've been having adequate sex, you've been ovulating, you've been you have not been using contraceptive, you've been trying consistently for 1 year. When nothing happens, then we say, okay, there's something wrong. But in most cases, the fact that you ovulated and then you met that same month does not automatically just mean pregnancy. Some women are that lucky. They shoot it like that. They know they're ovulating. They meet with their husband. That same month it happens. But not the case with most women. Sometimes it takes months. Some people, they do it. It's after 2 months or 3 months they get pregnant. Some, it may be up to. But if it's up to 1 year and you're not getting pregnant, then you need help. You need to look what is going on here. So that's why you just don't label it that, okay, someone is infertile. You must have been having adequate sex for 1 year for that. Please, doc, can someone with bilateral latent, I want to believe you mean patent, fallopian tube and pelvic adhesions still conceive? Yes, she has patent tube, but if she has adhesions, you want to be sure where are the adhesions, because if the adhesion is actually causing the fallopian tube to be away from the ovary, it may be difficult for the person to get pregnant. So if you're having adhesions, I'm going to be thinking maybe you've had infections before, you've had probably PID, or you've had a surgery before, because those are the common causes of adhesion in the pelvis, for you to have adhesion and all of that. And you just mentioned patent tube and adhesion. I don't know, I'm the one rushing now to think the adhesion is in your pelvis. Is it in the womb? If there's an adhesion in the womb, it needs to be broken. They need to cut those adhesions, because if you're having adhesions in the womb, it means the womb is kind of glued together. There are scars drawing the womb together. So pregnancy is not able to stay in that kind of womb. You need to work with your doctor. Is it possible to bleed during ovulation? Yes, some women sport during their ovulation. Not like it would be like menstruation, but they have some degree of spotting, and that's normal. Please, is it true that someone with blood group AB negative find it difficult to get pregnant? That's not true. If your resource negativity resource status should not be a factor that you can get married to a particular person. AB, there's nothing special about maybe someone AB. If you're AB negative means your blood group AB and you don't have the resource antigen, the popular resource factor that we want to check is the D. There are some other resource antigen. Then on this, if you don't have resource, if you marry someone that is positive, that is resource positive, meaning they have that antigen on their red blood cells, and most kids, the kind of peak resource, the resource gene usually comes from the father. If that happens, it means you have a child that is resource positive. Once this child, usually at birth, at delivery, or sometimes from 28 weeks, sometimes mother and child may share some blood cells, can come from your child into your system via the placenta, or during delivery, some of the blood cells of your child may get into your system. So you want to give ROGAM. So usually at 28 weeks, you want to give a woman ROGAM, a woman that is resource negative, and the husband is resource positive. But if both of you are resource, you are O negative, you are AB negative, your husband is O negative, or you are AB negative, your husband is B negative, both of you negative, you have cancelled each other. Both of you don't have the antigen, so nobody is sensitizing each other. So, but if your husband is positive, resource positive, and you are resource negative, the baby being positive, resource positive, it's going to send that, and if the body gets to sense that antigen from your body begins to look at this. What is this foreign thing? What is this foreign thing? And can develop antibody against it. So it may be difficult for subsequent pregnancies, but does not mean they don't get pregnant at all. That's not true. So please, doctor, can I get pregnant now after third C-section 5 years ago and miscarried 18 months ago? You can get pregnant, definitely. You've had 3 cesarean section, 3 major surgeries. I like that. You can still get pregnant. Doesn't mean that, okay, no, you can't get pregnant. But the more surgery you have, we really don't advise it. Cesarean section is a major surgery. Consider that if you had your babies, they are fine. You miscarried the pregnancy. But I'm assuming the 3 years, you have 3 kids or maybe 2 kids. The Lord bless it. You can do that. Please, is it possible to be pregnant, but pregnancy test and ultrasound show negative result? No, it's not. Please don't let anybody fool you. Don't let these cryptic pregnancy women tell you otherwise. If you think you're pregnant, or you think you have symptoms of pregnancy, your body can play tricks on you, especially if you just want to get pregnant. Sometimes you begin to feel symptoms that are not there. You begin to feel, sometimes we call pseudocyesis, pseudo-pregnancy, false pregnancy. You begin to feel as if you're pregnant. Some will even feel they felt baby kicking. Your mind, the mind is very powerful. You can play that much on a woman. You begin to feel it. But you do blood tests. Because usually if you're pregnant, what you test for is the HCG, human chorionic gonadotropin hormone. If you're pregnant, your placenta should be secreting that hormone. Because if you're pregnant, definitely you have a placenta. Placenta must be secreting that hormone. That is what we test for when we do blood tests for pregnancy. If you're pregnant, you should have that hormone. If you don't have that hormone, then no pregnancy there. It just means that. Then you don't do ultrasound. If there's a baby, you should see it. If ultrasound can't see the baby, then where is the baby? It is not there. It is not. So if it is not, if they can't see it, don't let anybody sell you. Don't let them sell you any zombie or sell a lie to you. It is not there. If you think you're having this pseudocyesis, you're having pseudo-pregnancy, you're really feeling pregnancy symptom, it may come. It can be psychological. You may need rehabilitation. Seek the help with a doctor. Don't let women prank you into it. You are pregnant. You see, doctors can't see it. We will help you deliver. They are beginning to sell you a lie. Don't do that. Don't do that to yourself. Please, doctor, what do you advise someone with PCOS that has been trying to get pregnant? I need that person to work closely with the gynecologist. If the person is more than 35, I need the person to step it up and go to a fertility specialist. Time is of essence. It may be difficult. Treating PCOS requires patience, because sometimes you're going to do some tests, they're going to give you drugs, we'll watch for a while. If there's no positive finding, you're still not pregnant, they may need to take it higher. Okay, you're taking metformin, you are having to lose weight, because that's another thing. You'll be on exercise, it's still not working. Sometimes we're offered, okay, let's do ovarian drilling. So many things. Patience, follow closely, patience, and keep having adequate sex. Don't stop doing that. That is required. Can a woman who has a vertical CS undergo normal delivery but be cut horizontal? I don't understand this question. But if you had cesarean section before, when we talk about different cuts in surgery, the cut that you have on your abdomen may not indicate the kind of cut you had on your womb. So if you had a vertical, I don't know what you mean. Vertical is not being used in this age and time. But if you had a vertical incision, I believe there's going to be a reason. There's going to be a reason why a doctor chose that, because usually the fan and steel is the choice, is the more cosmetic one that is used all over the world. You can have both vertical and horizontal, but man, the scar on your tummy, man, the doctor can do well and just more oftentimes, if you had a vertical scar, your doctor may want to maintain that scar and use the same scar so you don't have so many scars around. Please, doc, can someone with pelvic adhesion still conceive? How severe it is? The severity is going to determine, because if you have adhesion, the fallopian tube is just scattered everywhere. The fallopian tube is so elsewhere, it can't pick up the egg. Pregnancy may be difficult. The ovary is matted to the head of the bladder. The bladder is matted on. There may be problem. There may be difficulty getting pregnant. But if it's some small levels of adhesion, things are still okay. Pregnancy may be possible. Can womb massage help fertility? It has not been proven. If you want to go for massage, see, I don't have a problem with people who want to massage, because it's just the body. If you want to endure the pain yourself, that's okay. If you want to pay some people to just do, but womb massage in that sense, there's nothing. Do you know where your womb is? It's deep down in your pelvis, like deep down in your pelvis. For a non-pregnant womb, it is deep down. Sometimes I saw a video, a woman just held the woman here and was doing like this. I was smiling, because that's not where the womb, if you're not pregnant, your womb will not be there. Your womb should be inside, like it will be under the bone here. Your womb is in, it's not even out. So that's not your womb they're actually touching. They're just shaking your intestine everywhere. You can pay them some naira if it makes you feel better. Massaging has a way of kind of cooling people down. Some massage, it does. Especially if you go and do deep massage. I remember the first time I went for deep tissue massage. When I woke up the next day, all my body was aching. But after some days, I felt better. Massage has a way of making you feel cool, So if that is what you want, that's fine. But improving fertility, what they are touching and they are massaging, the truth is, it's not your womb. So let me just bust that. If you want to go for massage, that's okay. You can go. At what month will pregnancy bumps start showing? It differs from person to person. It is genetic. Some, their pregnancy is not even up to 3 months, it's showing. Some people at 6 months, you barely know they're pregnant. There's no rule to it. As long as your doctor is beginning to check, they'll check your fundal height and it's matching and it's working. That's all that matters. The bump, ignore that. It depends on your gene. Some people, their bump is going to be so big, it will look like there are so much. Like someone like me, when I had my twin, it was looking like I was going to fall forward. The bump was just shooting out. Everywhere I was going, everybody, when is the due date? And I'm always smiling. Hello, I'm not even close. So some people have big bumps, some will have it little. So it's all genetic. There is no particular time that your bump must come out. Please, is it right for the midwife to put her hands back into a woman who just delivered in the name of clearing cloth? What could be the disadvantage? It's okay. It's really if they think you have cloth. That's fine. It's something. It may not be. It's a painful thing. It may be a painful. I expect that to be done at least with some pain relief, because not just it's so painful. Dipping all the hands in there. If there is no indication, but there are some times where if they suspect that there are still cloth in there, or there may be some tissue that are left and they need to get them out, it's okay. At any disadvantage, the blood is going to come out, the body is going to heal. I'm sure you're going to be covered with some antibiotics, and I'm sure what is being used is supposed to be a very long sterile glove. Sterile. So there's supposed to be a reduction in infection with that. Please, doc, what is thyroid disorder? Thyroid disorder is going to mean you have issues with your thyroid hormones. And the thyroid is very important for your basal metabolism. That's how your body runs. It's very important. It can have effect on fertility too, because it is part of the metabolism in your body. What advice will you give a 40-year-old unmarried woman who has not seen her period for 9 months? What are the chances of getting pregnant? First, is she wanting to get pregnant? Because that's another thing. Is she wanting to get pregnant? Her chances of getting pregnant, it's still just as same as anybody. It doesn't matter if she's married. So the caveat of an unmarried woman doesn't matter. Whether she's married or unmarried doesn't change it. She's 40 years. Her fertility is fast winding down. So if she wants to get pregnant, she needs to work with a fertility specialist. Time starts counting. From 40 years, if she has not seen her cycle, the truth is, does it happen in their family? There are some people that they go into menopause early. But at 40, if it happens, if a woman goes into menopause before 40, we call that premature ovarian failure. But from 40 years, we won't term it abnormal. So is she actually going into menopause, or is it just some hormone imbalances? The doctor will check. If she wants to get pregnant, she needs to hop it up and go to a fertility specialist. That's the advice I have for her. So, Doc, there are different mix of folic acid. So which of the folic acid is more better to take? None is better than the other. Any of them. Some will write folate, 400 microgram, samely. Some is folic acid, 5 milligram, same. Just take it. Your body is going to convert both that folic acid. The body is going to convert into the active state it needs, folate. Your body is going to make that. Please, doc, can someone with pelvic adhesion still conceive? I answered this question. I was told I have hormone blank. Sorry, Ayola, you have to say your question again. I can't make something out of it. What is the difference between blighted ovum and miscarriage? Having twice blighted ovum after one child, what test can one do? If it's a chromosomal issue, can it be solved? And if it is the old eggs cause of one's age, what is the solution? Unfortunately, when a woman, once your egg quality starts going down, you can reverse it. It's the truth. You can halt the progression by eating healthy. Eating healthy, exercise, good food. You eat good food, you're taking food that are rich in like vitamin C, antioxidants. All these the vitamins, antioxidants, they can help, mop up free radicals in your body, help to, take off some of the damage, some damage radicals that may go on to damage your eggs and all of that. But once the air quality starts reducing, you really can't reverse it. You can't reverse it. You may be able to halt the progression, how it's going to be so fast, but you can't really stop it. So if it is due to old egg, whatever such kind of women get pregnant. I mean, what you want to do, if she's been having issues and it's being confirmed it is chromosomal issues. Chromosomal issues is likely due to the fact that she has old eggs. Does she want to use a donor egg? Does she want to keep trying? Because sometimes the more you keep trying, you keep halting yourself. So you just have to, that's why we talk about age. If a woman wants to start, you're above 30, but then especially if you hit 35, man, you need to start running. You don't just wait. Let me try. I will do some more fasting and prayer. As you're praying alongside, walk with your doctor. So as your faith is working, you're also walking. Faith and works, they go together. Don't just wait and be laid back. Do that. Take that step. Someone saying, do bomb show first month of conception? How now? First month of conception, even you may not even know you are pregnant already. Doc, is it possible to have UTI with have the symptoms? No, if you have UTI and you don't have the symptoms, you can call it bacteriuria. You can call those bacteriuria, meaning you have bacteria in your urine. It's some form of urinary tract infection. But for you to actually call it, term it urinary tract infection, symptoms have to be there. You're going to find symptoms like, you're having pain when you urinate. You can have blood in the urine. You're having to urinate frequently, and then even when you want to urinate, you feel like you have to urinate fast. Some other things. If it's left untreated, some people can keep having, you can have flank pain when it's beginning to involve the kidneys and all of that. But you can have bacteriuria when you have bacteria in the urine. That's not supposed to be too. But for UTI to be diagnosed, there has to be some symptoms to it. Please, what makes one to feel the urge of urinating while exercising or while having sex? You likely may have weak pelvis. You may have weak pelvic muscle. When you feel like you want to urinate while you're exercising, that means your pelvic floor muscles are weak. Or especially if you're someone that you notice that you used to drop urine every time you cough, or anytime you sneeze, or anytime you try to do jumping rope. It means you have weak pelvic muscles, and you need to take Kegel exercise serious. Kegel exercise, it will help to tone your pelvic muscles. Every woman should do Kegel exercise. It's very important. It says, can someone with pelvic adhesion still conceive? The network cut me off. It is possible, depending on the degree of adhesion. If you have pelvic adhesions, if the tube is still in place, still close to the ovary, it's able to pick up the egg, it's fine. But if it is so displaced, it is not like it is so apart and, everywhere is matted together, things are so wrong in the pelvis, it may be difficult for pregnancy to occur. Doctor, please, my cycle keeps changing every month. It can be 32, 28, 40, 34, 30 cycles. What may be the curse of it? One, stress may be a cause. Another thing is you may actually not be ovulating, maybe having an ovulation, causing your body to just vary, depending on when your body begins to wants to ovulate, menstruate, then it comes up. But everything is still measured. Actually, they are still within the range of 28 to 35 days. So I'm going to take an average of them, and I think you can work with that. But if you have this kind of cycle and you're trying to get pregnant, and this has been going on for up to a year, that counts for infertility. Then you may want to seek help. Your doctor may want to check, is it due to hormone problems? Then you can be treated. Please, does beetroot serve as folic acid? Beetroot, I think I saw that somewhere. That's like I think it's a fruit. Is it a vegetable? Yeah, I think it's a vegetable. Can it serve as folic? It may contain a good source. I may not be able to emphatically tell you this because I didn't research that. I don't know if it's a good source of folate, but you can't use it to replace your folic. Take your folic acid too. Please, doc, what makes monthly flow to cease and later start again when one thinks she's already pregnant? That's why you shouldn't think you're pregnant, except there's a test that tells you you're pregnant. Don't just think it. Stress at work, can actually alter your cycle. Your menses may not come when it's supposed to come. Sometimes the state of your health can tell on it. Sometimes the COVID-19 is messing with people all over the world. Sometimes jobs are not certain. Some people are being laid off at work. Stress hormones are everywhere. Things can disrupt your menstrual cycle. Don't assume you're pregnant until a test tells you you're pregnant, and you show that. So don't assume. That's why you don't assume you're pregnant until you're sure you're pregnant. So, doc, can someone be 18 weeks pregnant with belly movement? I don't understand what you mean by belly movement. If you mean that can baby start kicking by 18 weeks pregnancy, yes, it's possible. Quickening, we'll call quickening, that's when baby kicks, can occur from 16 weeks, between 16 weeks and 24 weeks in most women. So anytime from this range is okay. But some women, every time, most people will say, I'm not feeling my baby kick. I'm not feeling my baby kick. If you don't feel your baby kick and you're up to 24 weeks, then that's when I'll be worried. I'll ask you, okay, you need to get an ultrasound. What is wrong with this baby? Why is this baby not kicking? You should feel baby's kick by 24 weeks. But if it's earlier than that, if you still don't feel it, it's still not an issue. Just calm down. You feel the baby. You will feel it. They will kick and kick until you are tired. You'll be the one to pray that baby should stop kicking. So it just requires some form of just patience. All right. So if you're pregnant, I expect you to be in ATG and C. Our antenatal, ATG antenatal, you should be there. These questions we're going to answer. ATG antenatal, you should be there. It is an obligation. We answer our women. We get to, pregnant women will tell you, I learned from this question. This person's question answered my question. You'll be able to learn. And even from some of the knowledge, you'll be able to, your subsequent pregnancy, if you decide you don't want to come again, that's fine. You can, from the knowledge you already gleaned, you can actually wade through. And there may be some other pregnant women around you that through ATG, you advise them correctly. I've been posting some things on breastfeeding, and some women have been saying, wow, I never knew this. You can take this knowledge from ATG and pass it on to other women. The aim of ATG, our very underlying aim, the reason why we show up every day, is that we want to deal good blow to maternal mortality. We want that to reduce. No woman has to die in labor. No woman needs to lose their baby without just baselessly avoidable death. No woman should die of hypertension in pregnancy. No woman should have a recurrent pregnancy loss due to diabetes. Every woman needs to be empowered. They need to know this. On fertility, nobody needs to be bullied with infertility. That is why ATG is there. So the knowledge you're learning in ATG or you learn on ATG antenatal, you can pass it to some other women. You can tell them, if you see a pregnant woman drinking alcohol, you can tell them, oh, madam, don't do that. Are you a doctor? Well, I'm not a doctor, but I learned from doctors. You shouldn't take this. And you give them the reason why you shouldn't take it. This is what ATG is about. So if you're pregnant, you should be in ATG antenatal. If you prefer a one-on-one consult with ATG doctor, our premium service is there to cater for that. You can be sure to get a response from us. You want a referral, we can always give you that. If you're part of those that, you're part of those that are going to conceive, those are those if you're having issues, you want to talk with ATG doctors, but you don't have it one-on-one. You can with the Telegram platform. Other women in that category that are going to conceive, you can also do that. We have some of these our services. Our moderators have been posting the link. Madam Elizabeth has been doing that. She's a great woman. So she's been posting that link. Take advantage of it. I expect if you're pregnant in ATG, the least you can do is be in ATG antenatal. So all some of these lies that they are going to tell you about pregnancy or breastfeeding or taking care of your child, you can get it debunked in ATG antenatal. Please, doc, can a nursing mother take ginger and lemon juice? Why not? It helps with nausea and vomiting. Lemon is a good source of vitamin. Both, they can go. Yeah, you can. How can I join ATG antenatal? The Madam Elizabeth just posted the link. But even if you can see, maybe you can see the comment that flipped. Just type in antenatal in our search bar at the top. You're going to get that information. Doc, I have been having cramping since 29th of last month, which was my ovulation day. Till now, even gassy and weakness discharge, and it makes me to sleep a lot. What does that mean? Ovulation is just a one-day event. So if you're having something that is still continuous like that, please see your doctor. It is not due to your ovulation. Only if you think maybe you're already pregnant and then pregnancy is beginning to tell on you, and that's quite too early. But I'm going to ask that you should see your doctor. Let them check you out. I'm on ATG, but I don't miss your live session. Oh, Agege. Maybe I'll look out for that name. I don't know that name. You must be part of the silent member. Really. There are some members that when they announce, oh, I delivered, I'm like, who is this? I've never heard them ask questions. So definitely they are just members that are silent. They are reading questions from other women and the answers to them, and they get to just use the answer. I'm sure maybe Agege is one of them. Or maybe that's not her name, because I don't know that name. But there are members that I know. They ask me questions like every day. Some of them will even like, Doctor, I don't have question today. I just want to say, my head is spinning me. Or I was breathing like this. Sometimes I see some questions, I laugh before answering them, but it is my obligation to answer every question. Doctor, please, when one misses her tetanus injection date, can she still go and take it if it's within that year, or she's to start afresh? You can take it if it's still within that year. It is advised that you complete your dose, so it kind of gives you a lifetime immunity, and you can just get booster doses every 5 to 10 years. Complete it. If it's still within that year, yes, you don't have to start all over again. Doc, what's the easiest way of taking in once the husband comes back? Because my husband is not always in town, only comes back to spend just 1 month, so help me out, doctor. Distance is a barrier in this case. It makes it difficult. If you're a woman that you know your cycle is regular, in this kind of case, you need to take advantage of it. You need to go test. You have to dedicate a month, do a test. Maybe because your husband come, do a test to be sure that you're ovulating. So if the test, like hormone profile, can give a clue to that, or follicular tracking, if you're sure you're ovulating, okay, good. So you can now, based on your cycle, we have shown how you can calculate your likely ovulation time. So based on your cycle, whatever is your cycle length, let's say your cycle length is 30 or 31, 30 minus 14, that factor 14. For 30 minus 14, that will be 16. So on day 16 is your likely ovulation day. Or your cycle is 26, the 26-day cycle. 26 minus 14, that means 12. So your ovulation is a likely 12th, that's the 12th day of your cycle. So based on that, plan. This is going to be, so you menstruated on the 2nd. So starting from 2nd, the first day, you count like that until 16 days. So you know that you're likely going to be ovulating on this day. So you and our guy, you plan around that time. So if he's going to be around for that week, let him take that week or that particular area around your ovulation. 2 days before your ovulation, Oga can be around, is around on your ovulation day, and even the day after. Both of you can take opportunity of that. But if you're still doing that and nothing occurs, because distance is still creating a barrier, one of you may have to give. Oga may need to come closer, or you have to move to him. Someone has to give. Otherwise, distance, you keep seeing that distance, in years begin to go. And before you know, you are over 30. Before you know, you're 35, and then you want to do marathon. People start doing, Doctor, I've been trying for 5 years, I've been trying for 10 years. So don't wait. So if you keep doing that, if you've tried your cycle for some time and it's not working, one of you has to give. Someone needs to move. Doctor, please, Clomid has been helping me for conception. Please, I need prescription on how to take it. Your doctor, whoever has been tried it for you needs to. If you take Clomid without being watched or without discretion of your doctor, Clomid can kill. You can have hyperovarian syndrome. You can gasp for breath, like you have fluid filling your lungs. You can have abdominal bloating. Your tummy is going to be super big or like fluid in it. So you don't want to take Clomid without your doctor saying so. So if you want a prescription for you to say help you with conception, it means I'm assuming that must have been a doctor. So go back to your doctor. Let them give you a prescription and watch you. You're going to be guided, and then, okay, fine. You may be given one cycle. Maybe there's nothing happen. You can be given another cycle. After that, they may need to, ask you to go on some rest so that you don't overweep and all of that. So hold on for that. You can go back to your doctor. Okay, someone says, please, doc, attend to this. What causes missed miscarriage, and how can it be avoided? I am assuming you just joined, and I've dealt with this question earlier. Most of them, you can't help it. They usually are due to chromosomal issues. There may not be something you may be able to, affect or do something to change. A woman's egg is usually older than her. I mean, if you're 26 years, your egg is 26 years plus, like 9 months. Because at at fertilization, your eggs, the body will begin to differentiate. Once it differentiates into your female gonad or a male gonad, it starts making the egg. So your egg, in that sense, is older than your chronological age. So an egg that has been standing for 30 years, I mean, some damages may have gone into it. And if it's a damaged egg that was fertilized, of which a lot of them may have gone through that as your age begins to grow, can occur. The pregnancy, your body just stops supporting the pregnancy, or the placenta is not doing well enough, the body just withdraws its support, so can occur, can lead to miscarriage. But if it occurs, we say this, when you have miscarriage after three miscarriages back to back, recurrent, it qualifies when say recurrent miscarriage. So that needs to be, you want to check, your doctor wants to check you before next pregnancy. What is happening? You want to check your thyroid. Is the thyroid okay? Your basal metabolic rate, what is going on here? You want to check and look. If it's now not based on it, nothing, no hormone is wrong, they're thinking about that, okay? Maybe look at your age, is it due to age and all of that? You want to give you antioxidants, so you need to work with your doctor. Most causes of miscarriage, you can't help them. A lot of them are chronic chromosomal issues. You don't help them. Your egg has been there before you're conceived. Please talk, and someone with uterine fibroid conceive? Yes, they can, depending on the location, depending on the size. If you have a fibroid that is as big as the size of a baby, there's no way baby wants to stay. So that kind of person may be having miscarriage, because fibroid is practically taking over the womb. So, or it is something that is located on the cervix, maybe making the cervix, the cervical canal so tiny. That's possible. So, but most fibroid, they really won't cause issues with you getting pregnant, most of them, based on their location, except the pregnancy implants on the fibroid. And the baby is thinking they just implanted in the womb, not knowing it's sitting on the fibroid. So, without good support, as the foundation is wrong. The baby is not implanting on the person is supposed to implant on. The pregnancy may end in miscarriage. That may happen in very rare cases. Someone say, Doc, please, what could be the curse of not getting pregnant from teenagehood till date that she's 32, not even by mistake and trial? She needs to walk up to a doctor. They need to find out. There are so many cases. There may be so many things. Is the hormone right? So many things can be wrong. Is the hormone right? Is the fallopian tubes, are they open? You want to check. You want to check some of her history. Are there any instrumentation that has gone on before? Are the wombs open? Are they patent? Is there any adhesion? Then the husband. Let's talk about the man. Is the sperm okay? It's not enough to produce semen. Are the sperms, are they good guys? Are they able to run? Are they lazy sperm? What about their morphology? Are they a good sperm? Is it not sperm that has two heads, or does it have two tails? You want to look at the sperm and everything. It takes two to tango. So it's not enough. The fact that she's never been pregnant for 32 years does not mean the fault has to be from her or the issue is with her. You want to check both husband and wife. Doc, what do you have to say about alkaline food and testing of pH level to favor chromosome for a baby boy? Theorists, not proven. They are not. Let me tell you about alkaline water, all of this, it decreases cancer. They have not been proven. So up to now, no, they are not. They don't. So alkaline is going to make it easy for baby, for the boy sperm to do better, to be able to outsmart. Theorists. They have not been proven. Please, Doc, what does copious fluid in the pouch of Douglas indicate? Well, depending on the time you took the ultrasound. Maybe you pointed out probably you just had the ovulation. Maybe you pointed out you have an infection. So a lot of things that come in place before I can just reach a conclusion about that. This is a similar question. What is the meaning of fluid in the pouch of Douglas? I just answered. Doctor, please, can cold water affect baby in the womb? No. Your cold water goes into your stomach. Your baby is in your womb. When you take cold water, you may feel your baby shake. They can, because of the proximity, they may feel it. Not because it's touching their skin or they're feeling, the baby can. Or if you eat any food, your baby may react. Your baby, sugar rush, your baby can have that. But it's not. They are different compartments. Your baby is also still in a sack of fluid away from the water you're taking. So that's not what is causing any issue. Doc, what could be the curse for someone trying to conceive after a year fibroid surgery? Before she had fibroid surgery, she was trying to conceive. So after she had the fibroid, she's still trying to conceive. So whatever is the curse of not getting pregnant in the first place may still be there. So that's why we say fibroid, it rarely causes infertility. I say except maybe based on the size and it's symptomatic. Those things you say. So That is, you don't tie it to the fibroid surgery. She had an issue. She had issues getting pregnant before fibroid surgery. So the issue may have not been dealt with. She still needs to go to the gynecologist. Whatever was causing the issue, whatever was the cause of it before the fibroid surgery, still needs to be handled. Doc, can folic acid and vitamin B complex be taken together? Yes, most likely in pregnancy, especially if you're pregnant, you can take that. Can a blocked fallopian tube be open? A very dicey question. I don't want to say impossible, but very, 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 very difficult. Very difficult. Can it be opened? There are surgeries that have been tried, they will try to open up the tube. Oftentimes, when the body tries to heal again, it will form scar again, then it will block again. So, almost always not successful. Except maybe probably there are some tiny, those are not like true blockage. The doctor can try to do arterial tubation. They want to flush the tube open and all of that. Some have been able to record some success, but real scarring, like due to severe inflammation and all of that, usually is very difficult on blocking a blocked tube. All right, so I think I'll just be taking very few questions more, and I'll be ending that for today. Someone says, please talk, what's someone that had miscarriage use to clear the retained product in the womb without going for evacuation? Please go for evacuation. Please do. You leave that stuff there, it can get infected. And when it get infected, that will be endometritis. The womb is going to heal, it's going to scar. Then it becomes more difficult to get pregnant. So you don't want any problem, go for evacuation. If immediately when the miscarriage occurs or around that time, there may be some drugs that may be given to help the womb contract and try to expel it. If it's past that time, it may be more difficult for any drug to help you really contract and expel it. And even if you're given drugs by your doctor, there are some drugs that can be given. If you're given those drugs, you still have to do an ultrasound scan to be sure that the womb is actually empty. If you leave anything in that womb, it can get infected, and infection in the womb makes it more difficult to get pregnant. What causes scarring in the fallopian tube? Most times infection are usually the cause. Inflammation. Doc, please, how can one get pregnant with PCOS? Following up, good follow-up with your doctor, with a gynecologist. It requires you being patient. There is no hard and fast rule. It's not like there is a fast method or so. It needs patience. I was answering someone on similar question before. Patience, follow up with your doctor. Doc, is cold drinks, e.g. Team bitter lemon affect the baby? When you take something like, maybe you're talking of bitter lemon, I'm thinking of, we mentioned team. If it's team, that is the soda drink, all this Coke and everything, those are junks, empty calories, junks. Don't take junks in pregnancy. Take water, they are good for you. Take water. Water is good for your baby. If you want to flavor your water is just boring, you don't like it, you can now squeeze lemon into it, let it have flavor. Or some will tell you they want it to be slightly sweet. Then maybe pour a little Ribena in it. Then you can pour little thyme in it just to flavor it. But let your drink be water. Water is what you need. How can one undergo PID test to achieve conception having had tubular pregnancy? I don't know what you mean by that. Undergo PID test. If you want to check for PID, you can have to do eye vaginal swab for MCS. The infecting organism can be gotten, can be cultured, and then you can be treated based on that. What other question? Okay, saying, Doc, please help. I only see my period just for 2 days. What may be the curse? 2 days period is okay. It's fine. Doc, can staphylococcus prevent one from getting pregnant? No, it doesn't. Where is the staphylococcus? Staphylococcus, you may find some in your vagina. They are not a cause of infection, except you're having your staph up in the womb. And if there's staph up in the womb, I'm thinking maybe there was a septic abortion somewhere. There was an infected instrument that was introduced into the womb. There has to be a way for staph aureus to get into the womb and cause problem. There must have been a way it was pushed in. Staph aureus does not prevent you from getting pregnant. I know a lot of people say that on microphone. Staphylococcus and everything. They're lying. I missed the reason for taking a folic acid prior to conception. Oh, it means you just joined. You should watch the presentation all over again. You want to take it at least 3 months before getting pregnant because you want to build up your pool. Because let's say you're one of those that get pregnant and you cannot keep anything down and you are vomiting. Your body will have to pull on the pool that you have, your reserve. So if you don't take enough, you don't have enough in your reserve, you don't have enough stored up in your liver to cater for those times when you are having pregnancy, vomiting and everything, your baby may become defective in folic acid, and you can give birth to babies with abnormalities or even lose the pregnancy if the body decides, if the body decides that this baby is defective. So it is important to build up your pool, your folic acid pool, your reserve pool, so that your body can at least take demand from it if there's a need. And it's important when you're taking it, take it 3 months, at least 3 months before pregnancy, and at least 3 months into pregnancy. We are encouraged throughout pregnancy, but if for any reason you can't take it for throughout pregnancy, that first 3 months, do anything you can. Take folic acid because of your baby. All right, so this is the question. This is how much I'll be taking today. If you're pregnant in ATG, it is important that you be in ATG and C. It is very, very important. It is important because then you'll be able to be sure you're getting answers from us. Pregnancy is a very delicate time. No woman should lose their pregnancy. No woman should. You know, this person is bombarding me with this question. Taiwo Luatosi, I better answer this question. She has posted it like almost 10 times. What are the symptoms of womb infection? Unfortunately, the woman may not know. If you leave any retained product of conception in the womb, the infection can keep going on. The woman may not know. Some will now begin to feel things coming up. You know another thing that can cause womb infection? Yoni pills. All of these things I used to insert, they can cause it. Because when you leave them there, a lot of them are not sterile. You put them in the womb, you can get infections, can grow up from there into the womb. Infections can from there go from the vagina, colonize the vagina. You can have them. Some will push them in. They will tell you to push them in. When you now start seeing those thick discharge, those many discharge that are coming out, some people will say, wow, when I put the yoni pill, if you see the discharge that came out. Sometimes when people say that, I don't want to laugh because I'm just laughing at you. You're almost dead. You're already hurting yourself. Whenever you begin to see that copious discharge, that is your body reacting. You have already started off a process that may destroy the whole course of your reproduction. Because if you put anything in your, I can sell to you today that, see, I have this mighty thing, I have this superior thing. If you put it in your womb, I just tie a stone, and some people will buy it because it's Dr. Esther saying it or someone is saying it. If you tie a stone and you put it, don't even tie it, just put it in your vagina. If you leave it there for 3 days, some people will say, I leave it there for 2 days. Leave it there for 2 days. Bring it out. You will see the discharge that will come out. Does that mean it has detoxed? It has cleansed your womb? No. Your body was reacting. It's something foreign. Whenever there's anything foreign in your body is going to try to expel it. Your body is already asking, what is this? Then it starts secreting. It's trying to push it out. It starts producing so many discharge. That is what is coming out. But ignorantly, people will say, wow, look at the dirt. The thing went to go and clean my womb. It didn't clean any womb. It was just trying to. There's a foreign thing, and the body is trying to push it out. The body is wondering, what is this? It's a set of inflammation. That is what is happening, not your yoni pill working. So you can actually use that. A retained product of conception in the womb can cause womb infection. You have stuff, you're dipping stuff into your womb that are not. Nothing should go into your vagina except tampons, and you have to remove them on time. Pennies and drugs that are being prescribed by your doctor. So infections, they can. And then some symptoms, womb infection, you can have fever or you can have chills, which are usually when it's overwhelming. And then foul-smelling discharge. The discharge becomes yellow, can be yellowish like pus, it's smelling. So those can be some of the clues to that. So that is what I'm able to take today. What is the effect of gestational diabetes to unborn child and mother? That's a very beautiful topic, but unfortunately I won't be able to dabble into that. Diabetes in pregnancy, that's a very big and huge topic. But if you have diabetes in pregnancy, be very sure you are with an obstetrician. Don't take it for granted. It can cause abnormalities, can cause congenital abnormalities in babies if it's not controlled. It can, for reasons that are still being found, that are still being searched, there's a very high incidence of sudden deaths of babies with women that have uncontrolled diabetes. So you must be under a doctor. Make sure that you're under a doctor. And for you, if you're having diabetes in pregnancy, you should be in ATG. We need to be following you up. We need to raise more dust. We need to ask you to raise dust. You need to be those that are counting feeder count and all of this. So thank you very much, everyone that has joined me today. This is how much I can take. So you want any of our services, you want to continue to have consultation with us, I'm sorry, maybe you posted a question I was not able to answer. Definitely you must have been seeing me picking questions. I'm just picking questions. There are so many members. I'm not be able to attend to everyone. And if I'm not able to attend to you, forgive me. I didn't particularly single you out to leave you out. I just pick questions like I see them. But one of the ways we can be sure, guaranteed to get answer from us, subscribe to premium service. You definitely get answer from us. If you're pregnant, ATG antenatal, we tell you things that are necessary, the amount of water you need in a day, vegetables, we remind you to do this, we remind you to do that. We tell you sometimes we can share some preparations with you that you need to, the body bottles, some other things that you need to know. And this Ajit Collins, she told me she's in ANC and she's not sleeping at this time. So those are pregnant women that are supposed to be sleeping. They are not sleeping. They are online now. So every one of you is supposed to be sleeping, actually. So, but I just invited few people online. But thank you all for deeming it fit to listen to us in ATG. As often you're trying to get pregnant or you're pregnant, drink water, eat healthy. It is our joy whenever the testimonies keep coming in. And subscribe to our services if you want. You want to keep hearing from us, and also to support ATG. Invite women, let them learn about the group. Invite women into this group. You know someone that has been trying to get pregnant and you don't even know how to talk to them because it's actually difficult. Sometimes you don't know how you want to talk to women that needs help. Just adding them to ATG to see the knowledge for themselves, maybe all that you do for them. So do that. You are already helping someone. So thank you so much for joining me tonight. Take care of yourself and have great sleep. Sleep is very important. Go to sleep. If you're in Nigeria, go to sleep. Thank you very much. Bye-bye.